So Al, as we're now coming in close to the end of this second wave, hopefully, what are some of the big issues that have really come up that have impacted the homeless community here in Winnipeg?
Well, COVID.
Yeah.
COVID's been a has had a huge impact. Less spaces in the shelters, for one, which means there are more people out on the street. Uh, you'll see people in bus shelters, and that's a direct result of COVID. Simply because and Code Red actually, because when malls close down, libraries close down, there are no places for folks to go, and so they inhabit bus shelters, and we have to develop some sort of education system to let people know that they have nowhere to go. That's why they're there, and we do have warming spaces, all around the city, and they're harder to get to, but we have vans, and we have the community driving people to and from but there's 30-minute time limits. Just 30 minutes, and you can barely get warm. When it's minus 40, you go and you need 30 minutes just to thaw. And so we do have warming places, but there's a time limit on that. So it really works against anybody that's on the street. It's compounded. They can't have their meals indoors. They're giving out bagged lunches, and so people are eating their bagged lunches when it's minus 30 outside. Things like that. There are no simple comforts anymore. During the day, folks really have to do the best under really dire conditions.
How does that impact losing those warm places to go, that being able to get out of this cold, especially when we had the cold snap? How does that impact somebody who's going through it to no longer have that security I say security loosely, but to have those options?
It's a real. I think that it probably. I'm sure we've had more deaths during the cold weather than we know. We've had a couple, right? We've had one just actually on the weekend and one prior to, and then we had one 2 weeks ago. Cold weather kills, and if people are out there in the elements, it's not safe. And they do what they can. It brings people together, in the camps and things. And but I would think that it would lead to more addiction issues as well, because there's nothing positive about it. And during cold spells again during COVID, it's hope kind of gets lost in everything. And it's our responsibility to keep that word out there and keep giving them hope that things will get better. But things are really, really dark. During COVID's been really, really bad. And on top of that, compounded with the cold weather, this has been one of the most cruel winters for homeless folks in history.
We've talked about the WHO coming out and saying don't do lockdowns because it impacts the most vulnerable the most. Have we seen that here in Manitoba with those lockdowns, with those shutdowns impacting people?
It's really directly affected them, because places to go during the day when the shelters closed down, Code Red, lockdown, closed Portage Place up the way for seating, closed City Place. There's roughly 500 places where people can sit during the city, during the day. The lower level at City Place, the second level at City Place, and Portage Place. Those are all shut down. You could not sit anywhere. You could not even use a phone, right? And so no communication either, because a lot of people use payphones. And secondly, places like the libraries, where it's a good place to hang out for a day, and those were closed, so there's nowhere to go. So people occupy bus shelters and huddle in places that you see people in places that you normally wouldn't see them just to survive.
In your time from when you were on the street or your years of advocacy, have you seen anything like this, or for the homeless people to go through this?
Nothing like this. My problem is I didn't want to wake up every day. This is where you get when you're homeless, and I think this is why people turn to drugs to escape homelessness. I used to, and I didn't do drugs when I was on the street, but I slept through really, really cold nights in wintertime, hoping that I wouldn't wake up in the morning. I would just pray, please don't let me wake up in the morning. And somehow or another, I survived the cold, and I did wake up the next morning. But there's that, you just carry around a dark cloud all the time. How do because I was personally isolated from everybody, that's what I chose to do. I didn't come around to the shelters or anything like that. I maintained my place over in this piece of junk wreck down Winnipeg in McPhillips, and I chose to do that. Community is really important to folks, and I just didn't have any, and I didn't feel like being around folks, you know. But and so maybe my hope was a lot less than anybody else's because I had nobody to surround myself with. But no, you are not in a happy place, that's for sure. And it leads to depression. I actually jumped off a bridge there in my life, and I know that we have a number of suicides on the streets as well. And I think with the barriers that have come up with COVID and cold weather, you know, I don't blame people for having the addictions that they do, because there's sheer escapism. You know, you have to do things just to escape, you know, mentally from it all.
Things like suicide, are you seeing higher instances, higher rates of that during COVID-19 among the homeless population, or?
Yeah, I know overall the numbers have gone up from mental health people, you know, saying that folks are, you know, have experienced because of the isolation. That's the average population, but I personally don't know about that, but I also know we've suffered deaths here, so I would just not blame people for having addictions, but I can't honestly say that there are that have caused suicide, but I would have to say that would probably be a really good guess.
I know you've touched on this before, but what would you like to see happen? What is the solution?
Yeah.
What needs to happen?
What I would like to see happen, if I could go back in time, I'll go back 10 years, 5 years at the latest, and start building new housing, or start building housing geared to income. Housing that when we take people off the street, they can actually afford to live there on EIA rates, on welfare rates, right? We needed those things to be built, you know, long time ago. We're at the actual lowest point in I don't like using the word affordable, but housing geared to income since 1991. Absolute lowest, and we have more homeless than ever. So why aren't we doing that? All three levels of governments have to really buckle down and focus not on shelters. Sure, you know, you need that's basically bad. We need money for shelters as well, but we also need to look, okay, the big picture. And so, you know, the city got 12.8 million from the government on Rapid Housing Initiative, and thank goodness that they've instituted 88 new units are going to be built for housing, and they've given away 12 lots for $1 or 15 lots for $1. You know, there's a good step forward. Those 15 lots can probably, you know, you may serve 100 people, maybe more. You need more and more of that kind of thing, and do not focus on the Band-Aid effect. You know, the government just spent $800,000, and I read in the paper they were patting themselves on the back for all that. They had a good food program built into that. Happy about the food program, but they built in more isolation units, which are not necessary at this point in time. They really aren't, because we just established another house. Use those isolation units for permanent housing.
Yeah.
You know, like, let's take the next step. No way to end homelessness. No way to reduce it if there's no housing, and that's the number one answer, and that's the future. If we're gonna reduce housing, that's the way to do it.